I'm still waiting. It's still saying it's setting it up. It's preparing it. So
yeah,
there we go. There we go. It's okay. I see a little bit of a delay, but okay, everybody. It's Dr. Linda of the Vascular Birthmarks Foundation, welcoming you to this month's Facebook Live with Dr. Colletti. I'm trying to log in on our, oh, there we go. It's saying we're up. There we are. We are live. All right. Oh, I gotta turn the volume. All right. I see you. Gina. Thank you, Gina. Thank you, Gina. Yeah, we had a little bit of a wonkiness with trying to log on. And I see we already have some people on. So, hello, everybody. It's Dr. Linda of the Vascular Birthmarks Foundation, welcoming you to the June 2024 Facebook Live with our VBF Italy and VBF Europe Director, Dr. Giacomo Colletti. Welcome from Italy.
Thank you, Linda. Thank you, everybody. It's, as always, it's an honor for me to be here. And I have to say, June is a special month for us because it's the day where we first met 6 years ago. So, you know, doing the Facebook Live in June is something very special to me. It's also special because, as you know, Linda, our recent achievements were just unbelievable just a little time ago. So we're so happy of being able to help people with significant and dangerous diseases. So
and not just AVMs, because I think your Colletti technique will be applicable to other vascular anomalies as well.
yeah, actually, I am using it to treat other complex cases too. Like, and I didn't tell you this yet, but you'll like it. Caposiform hemangioendothelioma, not responding to sirolimus, responds beautifully to modified electrosclerotherapy. It's a revolution, I believe.
Is so in the KHE case that you treated, is it diffused or is it localized, like focal?
No. It's focal. It's not
Okay.
an angiomatosis. It's the hemangioendothelioma local one. Still a tricky tumor to deal with.
Mm-hmm.
And it does work really. It's very effective in managing that too. So it's one of my favorite techniques now.
So what, as everybody is joining, we are really thrilled to have Dr. Colletti here talking about some new treatment modalities. There's so many things going on right now. Dr. Nasseri will be launching the venous malformation HIFU study, and Dr. Colletti's been working on what I've deemed the Colletti technique, which is his modification to the standard electrosclerotherapy technique, which has been around. People don't realize it's been around for cancer. And I think it's quite applicable that we've been kind of paralleling what works for cancerous tumors would, and in some cases, be effective in vascular anomalies because we share some growth patterns, correct?
Actually, that's one very interesting thing about vascular anomalies in general. So the principle behind electrosclerotherapy is that by giving an electrical current, we can make the cells open to let the bleomycin get inside the cell and destroy the diseased ones. The strange thing is that bleomycin is only supposed to be effective in those cells that are replicating, you know, multiplying. And we have always said that vascular malformations don't proliferate, when in fact it has to be different than that. At least a part of those cells must be proliferating, and this is why the electrosclerotherapy is so effective. That's very interesting and something worth investigating.
Agreed. Well, we have a lengthy question for you. Our first one, quite compelling, I must say, from Alicia Maria. Hello, Alicia. She says, Dr. Colletti, I have an ABM on my left scalp and ear that's been treated for 20 years by Berenstein, Weiner, Levitin, Ortiz, and Bastidas. The last surgery was in 2018 at Lenox Hill. I also had embolization by Dr. Ortiz in White Plains. For 3 months later, it started to bleed again. What to do now? If they do another skin graft, I'm afraid it will be useless since it always comes back. I'm very close to Dr. Levitin. He can explain my case better. I'm 74 years old and live in Miami. I also was referred to you as a Lebanese boy, which you operated on his ABM in his leg. Please advise me what else I have. A lot of anxiety. Thank you, Alicia Maria.
Yeah,
And
I
she's
know.
actually our Spanish translator for VBF.
Oh, really?
Mhm.
So Maria, these, well, I will have to take a look at your pictures and at your imaging too. But for what you are saying now, it looks like if it's really an ABM that rife, then you're a very good candidate for electrosclerotherapy, for modified electrosclerotherapy. Definitely.
Yeah,
That helps a lot.
yeah, and I would suggest, because she's so close to Dr. Levitin and you'll be on the same team at the Super Clinic in October in New York City, Alicia, please come. You'll get free lodging. You'll get the free ultrasound by Dr. Colletti. He'll be able to assess you for the electrosclerotherapy, and you'll also see Dr. Levitin. So look at our website at birthmark.org, and you can see where you can still sign up and get free lodging and attend all the sessions and get to see Dr. Colletti in person and have him actually give you a good in-person assessment. I think that's the best
I will be happy
thing.
to.
Alexandra Boutoy Mariscu says, hello, Dr. Linda and Dr. Colletti. Thank you. You are amazing. Must be our patients from our clinic. Lots of people on. Hi, Dora Jelavic.
Hi, Dora.
I would like to ask, what are the possible reasons why the entire area covered by a port wine stain could not be treated at once? Is there a maximum number of pulses that can be used in one PDL treatment?
Is that a patient we have managed?
Yes, I think she came to our clinic, and I'm not sure. She can write
I
back,
don't
Doria.
I don't remember the exact case, so I'm not sure I can express myself. I don't
Well,
remember.
let me ask you this. So if they come and they've got a port wine stain on the face, but then they also have it on the shoulder, the arm, the back, and the leg, what are you going to do? Are you going to treat it all at once? Are you going to treat
That's
it in sections?
if we're talking adults, I will let them decide. I can treat it all, but that usually is too much for the patient, not for me. So we usually split the treatment in a few sessions to cover the entire area. In babies, the thing is different because we have to decide for them. And again, when lasering is a thing of 1 minute, then that is not so heavy on the baby. If it lasts longer than that, then it may be traumatic. So this is why we usually split it. We don't do the whole area.
Thank you. Oh, Alicia is coming to the super clinic, so you will get to
Great.
meet her in October. And like
You
she
can,
said,
Alicia, you can send me a few pictures if you want to my email, so I can tell you preliminarily what I think.
thank you for that, Dr. Colletti. Gina can post your email. It's giacomo.colletti@gmail.com. And he can also review images if you have any. He likes
Okay.
to look at those ahead of time. So we have quite a few people on. We can take your questions. Hi, Kiana. Kiana's on from Trinidad. She's our new director of our Global Ambassador Program. So hi,
Hey,
Kiana.
Kiana.
She'll be at our clinic in October. And again, for everybody, oh, we have quite a few people. Hi, Jackie Elder's on.
Hi, Jackie.
Dinku, hi Dinku, hello everybody. So Dominique says, this is amazing. I can't wait for the super clinic. In October, I've gone 12 years without a treatment on my port wine. Well, you will be excited, Dominique, because you'll get to meet Dr. Geronimus
Oh, yeah.
and Dr. Colletti. Guess what? He may have the new Candela Pro by
Really?
October, and if he has it, we're using it at the super
Wow.
clinic.
Can't wait.
I
And
know.
this year, the Super Clinic is going to be something special because this is the 30th anniversary. You know,
That's
maybe
right.
not everyone knows that.
Right.
So if I can, Linda, please excuse me for saying this, but I think this would be a good occasion to donate for VBF because it's been 30 years that Dr. Linda has been dedicating all herself in helping patients with vascular anomalies. Actually, almost all of my international patients are referred to me through VBF, and I think we were able to help so many patients that have to be thankful to VBF in the first place. So try and come and try and donate if you can.
Thank
For
you. And it's the other thing about 30 years is we actually moved from a foundation to an institution because only 3% of the not-for-profits in the world make it to 30 years. And once you do, you become an institution, just like the NIH,
wow,
because you've been around for so long. But
wow.
we can't do it without the support of our donors. So thank you for that shout out. Lots of questions coming in. Dominique says, oh my gosh, I'm in tears. I just found out this was the 30th anniversary. Thank you, Dominique. And okay, so thank you, Gina, for posting that. Oop, got some questions coming in. Spella, hello from Slovenia, and thank you for your good work. My daughter had a laser treatment the end of May and had a reaction, skin burns. Now there is a scar on those places. We are using via lipogel. Do you
Yeah.
suggest anything else? Will the scars heal?
Well, send me a few pictures so I can take a look at the situation. Usually, if there is any scar, the product I suggest is uh, just allow me a few seconds because there are two of them, and I want to tell you the right one. It's I'll tell you at the end of this session. It will come into my mind. I'm sorry, this is a
Is
lapsus.
this like a topical, you mean, for when it
Yes,
scars?
it's the topical silicone gel. Um,
It's not CeraVe, I know that.
no, 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 no. It's
It'll come. It'll come.
I'm
Hello,
sorry.
everybody. Tiana. Hello, Carol. We can take your questions. We're privileged to have
Strataderm, strataderm. Yeah, that's
Strataderm.
strataderm.
Okay. So
Mm,
that helps with the healing.
yes, yes.
Okay, great. Okay, so let's get your questions. And again, Dr. Colletti is pioneering a new technique for treating extracranial AVMs. I'm very excited about the results. And you have done some venous malformations, correct?
Yeah, and some lymphatic too.
And
Uh,
lymphatic.
yeah,
And what are you
yeah.
seeing?
Well, the thing is, with venous malformations and lymphatic ones, electrosclerotherapy helps in reducing the number of treatments that are needed to get to the point. But the real difference is that where there are alternative solutions in the management, maybe not as good as electrosclerotherapy, but there are other solutions to manage venous and lymphatic malformations. There is nothing comparable to modified electrosclerotherapy in my experience with arteriovenous malformations. And I have been dedicating most of my medical career and research to try and find and you know that, Linda, to try and find a reliable technique to manage difficult and widespread AVMs. And I think with the modified electrosclerotherapy, we really and finally found one. We did the first patient 2.5 years ago, and there is no recurrence in all of the patients that we have treated, and the results are beautiful. So I think this is really becoming our new standards in widespread AVMs, definitely.
Well, as I told you, when we have our gala in October, this is one of the things I'm celebrating, because for me, 30 years of watching these patients have 70, 80 procedures, it breaks my heart. They're financially bankrupted. It affects them going to school, having a job, having a family, because they're out of work so much with the bleeds. This to me it's a miracle, and I'm just so thankful to be a part of this team with you, with coming up with this cure. It's like a highlight of my life. We have a great question or a statement. Mafia Esquivel Gamata is coming to the Super Clinic from Peru. She is bringing her son, who has a lymphangioma on his right cheek. In the last 20 days, it grew, it blew up, and it was infected. And they gave him amoxicillin with clavulanic acid, then dicloxacillin, but it's turning red again. Any treatment to recommend? This is all new for us because the lymphangioma was asleep for 7 years. So he's probably just getting into puberty.
Yeah, it may be, but even if that's not the case, what happens is that lymphangioma is actually a word that I don't love. Let's put it like that. Because everything ending with the suffix oma is supposed to be a tumor, and lymphangioma, which should be called lymphatic malformation, is indeed no tumor. What happens is that a lymphatic malformation is, as the name says, a malformation of the lymphatic system. So the lymphatic system always receives fluids from the interstitial spaces. So in that fluid, there is also cell debris, there is also bacteria and stuff like that. So when it gets into a lymphatic malformation, if it does, then it's gonna become infected. And when it becomes infected, that's the moment where the malformation usually gets worse. It swells, it's painful, it's red and all the like. So what I usually recommend patients in that very moment is antibiotics, and the ones you are taking are the right ones. And I also add steroids, because you stop the inflammation, the inflammatory reaction with steroids, so it helps speeding up the healing. So I would add the steroids.
I agree. By the way, I'm not sure if you're familiar with this, Dr. Colletti, but there is a pilot study that's happening now that's resurrecting OK432, the old streptococca that was used to treat lymphatic malformations in Asia. And it's now getting some clinical trial approval in the US. And I think it's very promising.
No, well, actually, it's nothing new, Linda. OK, 432 is a substance that was and still is widely used in Japan. And actually, that's the only place in the world where they produce this. I don't like it. I did use it. I don't like it. And the reason being that the way OK432 or picibanil is the name of the drug works is by inducing a brutal inflammatory reaction. And since most, if not all, the malformations that I manage are in the head and neck, and very frequently so involving the airways, I don't want any inflammation to happen there, because otherwise the patient may need to undergo a tracheostomy. So I don't like it, but I know there is literature. I know a lot of people in the world use it, especially pediatric surgeons. They like it. I don't.
Okay, well, we have some questions. One woman, Tiana Vera, she wants to know, is there anything topical yet for adults with vascular birthmarks?
Yes, this is something that we discuss frequently at the meetings, international meetings. There is no single answer to your question, meaning there are topicals that are used, for instance, for hemangiomas, okay? Timolol in the form of gel is used to ameliorate superficial infantile hemangiomas. And other drugs have been tried to manage several other types of vascular anomalies, specifically malformations. But the only thing that really seems to work effectively is sirolimus-based gels or creams to manage superficial microcystic lymphatic malformations. It doesn't really work in other instances.
Okay, thank you for that. Dinku Effie says, I have a question, Dr. Colletti. How do I know if the laser treatment has been effective or not? If the port wine looks the same even after treatment, and especially on black-skinned baby, how many treatments through a year do we need to proceed? Thank you.
Okay, very good one, this one. Uh, we don't really have a rule shared by international experts, but I do have mine, and others think just like I do. My principle is if you have two subsequent treatments that are not giving any benefit, real benefit to the patient, it doesn't really worth continuing lasering the patient. So you asked me, how do I evaluate if the laser was effective? Well, you should say it, because you have to have clearance if the treatment was effective. And how many times, provided the treatment is effective, you have a first period where you want to clear the port wine stain as much as possible. Then and I usually do very frequent treatments, say 3-4 weeks apart from each other. And then when you get to the maximum clearance, you will want to do 1 or 2 treatments a year to maintain the result. Otherwise, even if the clearance is perfect, if you leave it there, it will somehow recur.
Thank you for that. And this next comment is going to make you really happy. It's from Alexandra Buteau Marisescu. She came to our free clinic, which, by the way, there were 51 patients from 16 countries that were treated at Laserplast, and a major shout out to Dr. Matteo Tretti Clementoni for letting us use his facility, and his phenomenal staff there. I mean, it's just such a blessing. But Alexandra said, thank you for the 7th of June VBF Milano clinic for my son Caesar, 5 years old. He had his laser for the first time and the results are amazing. I'm so happy and proud. My dream came true.
Wow.
We returned to see Dr. Colletti in September. I can't wait to be there again. Thank you for
We
everything.
can't wait too. Thank you. That warms our heart.
Yeah,
That
I
you can
mean,
do it.
a mom's excited to come for laser treatment. I love it.
Yeah, me too.
It's wonderful. Thank you for that, Alexandra. We needed it. So Tiana says, I have a hemangioma vascular malformation. So would that work? But Tiana, there's no such thing. And being that you're an adult, it's probably venous, but you can email Tiana your images and your clinical
Me, and I
history to
will tell
Dr.
you what I think. Yeah, actually, this is one of the plagues of the medical field. We recently did a systematic review of the literature, a review of the literature where we analyzed hundreds of papers trying to verify if the diagnosis of hemangioma was a proper one. And we found out that in 85% of international peer-reviewed papers, the diagnosis was wrong.
Wow.
So you're very likely not having a hemangioma. There's no such thing as a hemangioma in an adult. So your diagnosis is very likely different from the one you're telling us. So I'll be happy to help.
Well, I'm very interested in that paper because I've been quoting for 30 years back to the 90s study done by Harvard, the Harvard group that said they were misdiagnosed at the rate of 65%, but you think it's higher, right?
You too, you're one of the authors.
Oh, oh, forgot about that. Okay, so hi, Sarah. Hi, Dragana. We're waiting for your questions. Dr. Colletti is here. He will be with us in October at the Super Clinic with his handy dandy ultrasound device. We do got to get an upgrade for you. You're
Oh,
due.
yeah,
You're due
I
for
would
a
love that.
I know we got to get one. We're talking all things VBARS, vascular birthmarks, anomalies, and related syndromes. We just came back this month from our free annual super clinic, and we will be having it again next June in Italy. I was thinking we would lock into like that first weekend of June every year, and then the families know, and by the way, letting everyone know I'm this close to VBF UK free clinic. I'm in the works with someone right now who has a private practice, thanks to a connection from Dr. Goldberg. And I had a Zoom meeting with them the other day. So
There's a huge need for that.
let's pray. You'll be there. You will be there at that clinic doing the ultrasound. So hi, yeah, Tiana says that's interesting. They told me it was a combination hemangioma vascular malformation
There's no
because
such thing.
I know, my birthmark on my face continues internally inside my mouth. I will email you guys for sure. Sounds like a venous malformation to me.
Probably,
Yep,
probably.
so Dr. Colletti will be happy. You can also copy me if you want, Tiana, at bbfpresident@gmail.com when you send him that stuff. So that's fine. We are here. We are halfway through our live with Dr. Colletti, our VBF Europe and Italy medical director. Today we're talking all things VBARS, vascular birthmarks, anomalies, related syndrome. Thank you, Gina. She's posting your number and ways for people to
Okay, Gina.
contact us. So thank you for that. Michelle says, grande il nostro dot Colletti.
Thank you, Michelle.
I'm sure I said that wrong, but
No,
okay.
no, it was almost perfect.
Okay, so Ivory is writing, hi, Dr. Linda and Dr. Colletti. I'm from Miami. I have a port wine stain on my left leg. I treated last year with the V-beam and it left hyperpigmentation. So I would like to know if I can use IPL like M22 instead.
I don't know about that. You should discuss it with your doctor. I cannot tell you yes or no. You should be my patient, and I would need to see you, evaluate how the pigmentation is, and then eventually decide what to do with you.
Yeah, and
So I'll tell you
Ivory,
yes or no.
you can also come to our free super clinic in October in New York.
That's the best thing you can do.
And you could see Dr. Geronimus, and he's not just a laser king. Every time a new laser comes out, he's the tester. And Dr. Colletti's been to his office, and like there's a different laser in every room. So he can give you a good assessment because it is true, right? Dr. Colletti, sometimes different lasers work better
Oh
on
yeah.
different skins and lesion type.
The thing most people don't get is what a laser is. A laser is an electromagnetic form of energy with a definite wavelength. Okay, so we're transmitting energy in form of electromagnetic wave with a specific wavelength. This means that energy will be absorbed by a specific color, you know, and that wavelength will also affect how powerful the laser can be and how deep the penetration of the wavelength, many things. So every single laser has its own indication. If you use CO2, for instance, very powerful CO2 lasers are used to cut metals, you know? So the applications of lasers are multiple, and every laser has its own indication. 1064, for instance, is absorbed by blue color, so that's perfect with venous malformations. 595 is absorbed by red, so that's usually what we use with telangiectasias and port wine stains and so on. So
Thank you for that. Jillian says, hi, Dr. Linda and Dr. Colletti. Thank you both so much for facilitating the free laser in Milan. My daughter Valentina has had 2 sessions with you and she's doing amazing. So thank you for that. And she says, yes, to a UK clinic. I know, Jillian, I'm working on it. I heard you guys and I've been trying for years. And Ivory said she would love to come. Also, Ivory, you know, you can message me at vbfpresident@gmail.com. I know most of the laser experts in Florida. So sometimes you can go back and forth between them to get opinions. So you can see Dr. Duarte and then you can go see Dr. Weibel because they're both laser experts and they have different techniques. So sometimes it's good to go to both of them. Oh, this is a good question, Dragana Dravorijic. So how can we treat the eczema on the port wine? It's very persistent, and is there any prevention?
So that's something that really bothers every single one of us, you know. Usually eczema is treated with a combination of antibiotics and especially steroids in the form of a cream. That should work. Otherwise, what I prescribe my patients is VEA lipogel, which is the second line treatment for eczema. But some of the eczemas in patients receiving PDL treatment can last very long. We don't really know why, but that can happen. It will go away, but it may take very long.
Also, there's a lot of discussion and different opinions, but Dr. Nelson does not believe you should have a laser until the eczema clears up. Do you
I
disagree?
don't laser over the eczema,
Right,
okay, but I do laser around it. For
right.
sure, I don't do it over the eczema. It doesn't make sense because eczema means red. So if you do the laser, you target that red and not the red of the malformation.
Right,
And you
exactly.
can do some damage too.
So Michelle, she's like, hi guys, when do you think you'll have a date for the UK? Well, and if it works, what I'm working on, so say some prayers, Michelle, because it's not easy to get into the UK, but if it works, it's going to be in March. And I will know within the next month if it's going to work or not. If not, I have a second option that I will look to. So I am working on it. Ashley Lay has a question. What are the related syndromes? Has memory loss been associated with port wine stain on the forehead, center of the nose, and AVM, large Gallium vein?
So memory loss, there is not a single specific association between capillary malformations and memory loss. When Dr. Linda says related syndromes, she refers to syndromes like, in this specific case, Sturge-Weber's, right? And Sturge-Weber is a syndrome because you have many different symptoms, signs and symptoms together. In the case of Sturge-Weber, you have the stain on the skin. You have a cerebral, meningeal actually involvement, and you can also have glaucoma in the eye. But if you ask me just specifically about memory, no, I'm not aware of any paper dealing with that specifically.
Thank you for that. This is a good question from Heather. Have you ever recommended different lasers for different parts of the body? My daughter, who is 3, has port wine over 50% of her body, but her body seems to be responding differently than her face. Her arms are not responding as well as her face. We just treated her legs for the first time, but they're so much more purple than her face and arms.
Yeah, that's a very good question indeed. And it's very difficult to answer to you. I mean, it is very easy to tell you that the face responds better than limbs. It is easy to tell you that the lateral part of the face responds much better than the midline, and the closer you get to the midline, the more scarce will be the effect. But why that happens, we're not sure. The thing is, in any case, regardless of the site of the malformation, you're not switching lasers based on the location. You're switching laser based on the response to that specific laser. I hope I answered.
Yes, that's great. This is a wonderful question from Bernarda. She came to the clinic 3 weeks ago in May, and she said Dora, her 8-year-old daughter, so this is Bernarda Vargovich, had great results. And she wants to email pictures to, and Dr. Goldberg wants to see the pictures as well. And she wants to know how she can get another treatment with you, Dr. Colletti.
But
So
Dora, how you can reach me.
yeah. So Bernarda, it's Bernarda is Dora's
Yeah,
mom.
sorry.
But I think this is a different one, but you are still lasering every Friday, right? At Laserplast?
Not every Friday. I'm sorry. I am overloaded with complex
I know.
anomalies, and Linda, because we share most of the patients that I treat. And those difficult, complex cases may require 10, 12 hours of surgery. So I will not have time in that case for lasering on Fridays, but I usually reserve based on the request of patients. I try to help babies as frequent as often as I can, but you can talk to my secretary. She's great, and she will help you deciding the good a good date for you.
But even if you're not even if it's hit or miss, I guess that's the phrase we use.
Yeah.
You're still doing them at least once a month, right? So
Oh
people
yeah.
can get.
But no, more often than that,
Okay.
just not every week.
Right. Okay. So that's good for me to know as well, especially with a lot of patients that travel. Um, okay. So Lauren says, my 5-year-old son has a port wine on the right side of his face. He gets laser every 3 to 4 months. Just before the next treatment, it seems to have darkened quite a bit in that short time in a specific area on the cheek and ear. He has been getting laser treatment since infancy. I'm hesitant to go to maintenance sessions because of these specifics part of his port wine. The rest of it has gotten excellent clearance.
I should see a few pictures because we have to verify if that is not, for instance, hyperpigmentation, instead of the birthmark getting darker. It is more likely that he had some hyperpigmentation in that area, and that doesn't have to scare you. Sure, we will not treat the hyperpigmented area the same way, but we will proceed with maintaining the rest of the face, and we will try to find a specific solution for the hyperpigmentation.
Well, the other thing is what I'm thinking, because I think the 3 to 4 months might be too far out, so it's recanalizing, it's refilling, and she may have to go monthly.
Well, for maintenance, that would be unusual, right? Maintenance, we usually say once or twice a year. So 3, 4 months apart is considered to be frequent for maintenance.
Okay. But it sounds like he has never really reached maximum clearance.
I really had to see him.
Yeah, that's okay. Another question, is it okay doing laser without anesthesia on children 4 years old?
Oh yeah, 4 years old. It depends. It depends. There are babies who are able to tolerate a laser sessions very well, others that cannot bear it. And another factor to consider is how extensive the birthmark is. So, for instance, if it's only a few seconds, then usually that's not a big deal, even for not compliant patients. But the things we have to bear in mind when we do that decision as doctors or parents is you have to balance the cost-benefit ratio. So if the baby is not traumatized, if he or she can bear it well, then I suggest doing it. Otherwise, I prefer to do it under anesthesia or delay it, or do it just once a year after he or she is older, and then resume a full schedule.
Okay. Kiana has a great question. How can a port wine stain dermatitis issue be treated on the scalp? I continue to have scalp infections, bleeding, and Dr. Bronner's shampoo hasn't helped much. It only clears up when I am on antibiotics.
That's again one of the things that bother our patients the most. Um, I would need to see you and, for instance, investigate if you have pyogenic granulomas, right? Because pyogenic granulomas require a specific treatment, and those are usually the lesions that are itchy, that get infected, that bleed if scratched. So it's are two different things. I hope I made myself clear. Where you have a capillary malformation overgrown with recurrent dermatitis versus a pyogenic granuloma happening over a capillary malformation. Those are two distinct entities requiring specific treatment.
So Kiana, make sure you sign up for the super clinic so you can see Dr. Colletti so he can examine you and give you some good advice. I know you're going to be there, but make sure you sign up for the super clinic. So Rhea Louise Jones says, my almost 1-year-old little girl has a segmental hemangioma and has made absolutely amazing progress on propranolol. But our UK doctor said any laser treatments to treat the leftover spider veins will be done when she's around 5. Is this the optimal age? Our UK doctors have been so uninformed about birthmarks and Facey syndrome that I don't have the most confidence. So if you can time the UK clinic for around or whatever she can have the laser, that would be fab.
Oh, yeah.
I don't even know if we're gonna have one. Well,
And by the way, I totally agree with you. Actually, in May, there was the ISVA meeting. ISVA is the biggest scientific society in the world dealing with vascular anomalies. And I had a discussion with a few colleagues because a group from, I will not tell you where, said that there is no need for laser, never, in the case of infantile hemangioma. And another group, friends of mine, doctors from Shanghai 9th People Republic Hospital, on a case series of 5,000 and something patients, they found out that at least 15 to 20% of babies with um, infantile hemangiomas requiring treatment had benefited from laser. And if that's the case, why would you want to wait until the 5 years of age? That's our philosophy. So I agree with you.
Agreed. J.A. Newton has a question. I have an AVM under my nose. An ENT doc removed it from inside my nose because it caused nosebleeds. It returned outside my nose, but no longer nosebleeds. It has spread, but slowly. Dr. Goldberg has been treating with a laser for over 10 years. He highly recommends Dr. Colletti. So maybe we'll see you, J.A. Newton, at the super clinic. And I mean, I do trust Dr. Goldberg because he's one
Me
of the
too.
top
Me
laser
too.
kings, but I
Me.
don't like hearing laser and ABM used in the
I
same
think
sentence.
I think you may be one of the patients that we have discussed together. I think. But you can, again, contact me through email and I will take a look at your pictures and tell you what I think.
Thank you for that. We're down to 12 minutes. We got a lot of questions coming in. Marina Verovic just says, hi, Dr. Colletti from Croatia, from Grigo. Claudia Maza, a VM in front and nose of 2-year-old, available for laser at what age, please? But a venous malformation in the front and nose,
No,
2-year-old
if,
patient.
if if that's the appropriate diagnosis, then usually laser is not the preferred technique. Potentially sclerotherapy or others are the treatments of choice. But again, and I'm sorry I have to say this, but it's the truth. I need to see the pictures and the imaging before I can tell you what's the best solution for your son.
Thank you. This is an email from Peru. So I'm not sure if it's Spanish or what the language is. It looks Spanish. It
Spanish.
says, hola, soy de Perú. ¿Cómo haría para mi den uno? Cita médica para padre. Vaya, mi niña tiene malformación vascular en su lengua.
Your Spanish is not so good, Lynn.
Sorry.
No, I got that. Yes, the girl has a vascular malformation of the tongue, but I didn't get much more than that. So you are free to text me and write an email. You can write in Spanish. I understand that. So I'll be happy to answer your email in Spanish.
Sorry, I did try.
No, I was just kidding, Linda. Sorry for that.
I know. So we have 10 minutes left to go. Thank you all for your questions. We can still take some questions. So if you have any questions right now for Dr. Colletti, now is the time. We only have 10 minutes left. Anything about the diagnosis or treatment of any vascular birthmarks, anomalies, or the syndromes like Sturge-Weber, Klippel-Trenaunay, Parkes-Weber, face syndrome. Those are the most CMTC, cutis marmorata. Those are like the most common syndromes that we, as you can see back here on my poster, we represent like 9 primary birthmark types. They're on our website. So those, there are many syndromes like Maffucci's and Proteus and Cowden's, and I've seen them over the years and I know what they are, May Thurner, but we don't see many cases. So they're so extremely rare that it's, if I have one a year or one every 2 years, it's a lot. But when we say the word vascular birthmarks, anomalies, and related syndromes, we're
Well,
referring
actually,
to
with the
mainly, yeah,
with
Sturge-Weber,
with the exception of Sturge-Weber.
Sturge-Weber, KTS, and face syndrome are
Yeah,
the
those
main
are
ones.
much more frequent.
So Dinku wants to know, what do you see and understand on the ultrasound of a port wine stain when you're doing it? What does it look like?
Very good question. So it happened to us and by us, I mean to Mia and Linda, to find out that very little patients who were diagnosed with port wine stain instead had a high flow malformation underneath it, and the diagnosis changed to capillary arteriovenous malformation. And in that case, laser is prohibited in my experience because it will ignite the underlying arteriovenous malformation. So you may ask me, why do you do it? Because even if I do a mistake, even in a single case, I may do things very, very bad for that patient. And that's the first thing. The second one is that there is although it's a little weak, correlation between hypervascularity and tendency to hypertrophy. So once we know that, we know if there's an indication to treat hypertrophy or to prevent it by injecting bleomycin. That's why we do it.
Thank you for that. So Claudia says, how can we get an appointment to travel? Claudia, you can go on the VBF website at Birthmark, birthmark.org, and scroll down and you'll see the New York City Super Clinic. You'll be able to come. We'll give you a free one-night lodging and you'll get an ultrasound with Dr. Colletti and a diagnosis. You'll see a whole team of people. There'll be free laser, free ultrasound, free psychotherapy, free dental for anyone with any vascularity in the gum or teeth area. So sign up, Claudia, at birthmark.org, and that way you'll be able, and then if you decide to go to Italy for treatment, at least you've seen Dr. Colletti in New York, and that can be your pre-op, and then you can always make arrangements with him and his staff to go to Italy for the actual treatment. So it looks like we're pretty caught up. We still have 6 minutes left. Let me make sure I didn't miss anybody's questions. We still have a few minutes to take a few more. There seems to be quite a few patients' names that I recognize from our last free clinic in Milan. So I'm really happy to see them on. Thank you, Gina, for posting Dr. Colletti's email again. And also, if you want to copy me on any of these, it's vbfpresident@gmail.com.
And remember, this is the 30th anniversary. So this is special.
Right, it is special. It's
VBF is
special.
becoming an institution.
It's yes, and not only that, we've reached 150,000 networked into treatment worldwide. So that's, I mean, the milestones. And the other thing is, Dr. Colletti, Dr. Geronimus will be receiving our Lifetime Achievement Award this year because he has donated over 1,000 free laser treatments. So we have a lot of milestones to celebrate. So I'm very excited about that. Thank you for that, Gina. Thank you for continuing the post. And we have 5 minutes left. I don't want to shut down because one of you may have an important question. All questions are important, and somebody may have just jumped on. We have 5 minutes left. We end at 1 p.m. Eastern time, which is 7 p.m. Dr. Colletti's time in Italy. So thank you for setting this time aside for us, Dr. Colletti.
Thank you.
And as I started this session bragging about the greatest achievement in my 30 years of VBF, which is to see there's actually finally a cure for patients with AVMs. And it even feels strange to be saying those words, huh, Dr. Colletti, to say you've come up with a cure for AVMs.
Just consider this. Just consider this. Many of the patients with arteriovenous malformations that we are managing right now with modified electrosclerotherapy, I would suggest to them and to colleagues not to touch it, until 2 years ago, because the likelihood of messing things up by touching an AVM without radically removing it before we had modified electrosclerotherapy, the likelihood I was saying was very high. So I would suggest not touching it. Whereas now with modified electrosclerotherapy, we can manage them early and even associate, combine electrosclerotherapy with surgery for aesthetic purposes, which is a groundbreaking news for arteriovenous malformations. It is, it really
So,
is.
so we have a couple quick questions. This one is great. Will lasering around the eye cause an increase in the pressure from people being diagnosed with glaucoma?
That is an excellent question. The short answer is no, because the fluid from the eye are drained around the eye back into the ophthalmic veins. So short answer is no, but you can have inflammation, and inflammation can engorge the vessels, so that may happen. Um, it's exceedingly rare though, and it has to be promptly recognized and managed with steroids. So that, to make a very long story short, we should treat eyelids even in patients with Serge Weber's. The likelihood of seeing an increase in eye pressure is exceedingly low. Even if it happens, steroids will help.
Thank you. What a great finish. Dominique says, thank you so much, Dr. Linda and Dr. Colletti. This has been truly a blessing for me. I've been in the dark to any treatment of my birthmark due to insurance here in Florida. I'm so excited for this next step in my journey. We look forward to seeing you. And Sarah's saying she's really hoping we can get into the UK, and so am I. So stay tuned.
We all are.
Yes, and stay tuned and make sure you follow us on our Facebook page, which is facebook.com/Vascular Birthmarks Foundation / you have to follow us. You'll see the announcement on there. If I find out in the next month that I'll be in the UK in March, which is my goal, March in UK, June in Italy, to give families 2 good laser treatments in our international families, 2 good free laser treatments and ultrasounds twice a year. That's my goal, because I know the difficulty you have accessing early intervention, accurate diagnosis, and even when you can get into treatment, it's a 6 to 8 month wait just to get an appointment. So I've been really trying to break through to that for a long time.
And you
And
did.
yep, stay tuned. I mean, I'm very grateful that we have you, Dr. Colletti, in Italy, that's always willing to offer the annual free super clinic that's really grown. It started just laser, and now we're bringing in Sturge-Weber evaluations. We've had KT evaluations. So it really is a super clinic. So thank you for participating. And you're right, June was a special month, not just because we met 6 years ago, but also because it's your birthday month. So happy belated birthday. I know you had your birthday this month. Next year is the big one, right, Dr. C?
It is, indeed.
So thank you very much. It's been a wonderful session, and I look forward to seeing you the next time.
Oh, yeah.
Thank you very much.
Thank you so much, everybody. Goodbye. Have a nice day.
Yes. And I'm trying to, okay, this is a little different. I'm trying to find how to, oh, there it is. Nope, still live. I think I have to go back to Zoom. It's not giving me my, sorry, it's not giving me my closed. Why is it, I don't see how to end it. Back to Zoom. Okay. There it is.